Hi, I'm Barbara Levin, past president of the American Association of Legal Nurse Consultants, and together with my friend Pat Iyer, we are hosting our 11th virtual LNC Success Conference, February 27, 28, and March 1, 2025. Our website is LNC.tips/February 2025 virtual. I'm here to tell you that you can turn your dreams of becoming a legal nurse consultant or even expanding your current legal nurse business into more business. You will learn about attracting the ideal clients, developing marketing strategies, and much more from the comforts of your own home or even your office. I'm here to mention that we are going to have a compelling session called Preventing Medical Errors, Risk Management, and Quality Assurance Strategies to Mitigate Litigation. The seasoned experts, Irene Nobles, MSN, RN, HCRM, and Diane Honigoski, BSN, RN, CLNC, are going to take you behind the scenes of an adverse medical event, as well as much more. Diane Honigoski is an experienced nurse with over 37 years in the healthcare system. Since 2002, she's worked at a designated Level 1 trauma center and stroke and cardiac center in the emergency room. She has worked in the ER Quality Assurance Department since 2016. Irene Nobles is an experienced nurse executive with over 3 decades of healthcare experience, having expertise in clinical risk and regulatory compliance in long-term care, acute, post-acute, physical rehab settings. Both Diane and Irene have authored a chapter in Pat Iyer's Medical Record Analysis, a Guide for Attorneys by Experts, LNCs, Volume 2. You can get it on Amazon. So I'm here today to discuss with both of you, Diane and Irene, about your topic. And if you could share with our audience a little bit more about your presentation.
Hey, well, thank you, Diane. And I just want to add to that is thank you, Barbara and Pat, again for the privilege of allowing us to present at the upcoming conference. It's definitely an honor. And I'm looking forward to participating and learning from the other speakers as well. So I come from a strong background of quality and risk management, having worked as the director of quality and risk, a patient safety officer for several years, as well as a chief nursing officer. So I speak from a big picture perspective from the behind the scenes of healthcare. And as Diane mentioned, it's virtually impossible to eliminate every risk that exists in healthcare. But one thing I believe to be true is that with hardwired processes and risk monitoring, a great majority of these risks for medical errors can be mitigated. So healthcare systems invest a great deal of time and energy in alleviating risks that adversely affect patient outcomes. And as a risk manager, one of the most relied upon methods for risk mitigation is error reporting and error analysis, because these are essential in identifying the breakdowns, where they occurred, improvement processes result from that, and it ensures regulatory compliance. So in turn, that results in reducing the possibility of adverse outcomes and then potential litigation that follows. So our presentation is going to discuss how incidents are reported, what happens on the back end after that report is filed, and how risk management and quality assurance work together to prevent future incidents from happening and avoiding litigation. We're also going to share some very alarming statistics about the most common errors that are reported by the Joint Commission and which one still remains number one year after year after year. And finally, we're going to present a case study where the participants will gain insight on how and what system failures occurred that led to an adverse medical error. And this unfortunately did result in irreparable harm to a patient and ultimately led to litigation. So participants will learn how to connect those deviations from the standard of care to those breakdowns that resulted in legal action. Through our case study, we hope that will spark some interest and some insight that people can apply to some case studies that maybe they're currently working on. So we're looking forward to it.
I am so excited to attend your session and learn about more of the golden nuggets. That's what I'm hearing from both of you, and the pearls of wisdom that will be shared. So for all of you who are looking to be a legal nurse consultant or perhaps expanding your business, this is quite the session to attend. This is going to be compelling, filled with lots of great information that you'll be able to utilize in your own practice. So if you are looking to expand your practice, gain more knowledge, insight, and so much more from these very experienced and talented speakers, and they are both experts, then please join us February 27, 28, and March 1, 2025. So if you go to the website, LNC.tips/February 2025 virtual. We look forward to seeing you.